Good afternoon and good morning, everyone. Welcome to today's webinar, and thank you for joining us. My name's Leah Whigham, and I'm the director of the Center for Community Health Impact and an associate professor at the UTHealth School of Public Health in El Paso. Today's webinar is co-hosted by the Michael and Susan Dell Center for Healthy Living at the UTHealth School of Public Health in Austin. The center's mission is healthy children in a healthy world. We are also co-hosted today by Live Smart Texas. Live Smart Texas is a coalition of organizations and individuals who work together to address the state's obesity epidemic, especially in children. I'm also a co-chair for Live Smart Texas. Before we get started, I just wanted to make some housekeeping comments. This webinar is being recorded and will be archived along with the presentation slides on our website at msdcenter.org. If you have any questions during the presentation, please enter them into your question chat box. We will have time for Q&A at the end of the presentation, and I will be moderating the Q&A portion of the presentation. Okay, if we could go to the next slide. The title for today's webinar is Value Chain Coordination for Improving Access to Healthy and Affordable Food in the Paso del Norte region. Next slide. Here's a list of our speakers today. The first speaker is me, Leah Whigham. I just announced myself and my affiliation. And then we have Gabriela Gallegos, who is also part of the Center for Community Health Impact and an associate professor at the UTHealth School of Public Health in El Paso in the Department of Management, Policy, and Community Health. And we have Adriana, director. Next slide. Next slide, there we go. We'll be talking about the Paso del Norte region and value chain coordination in the Paso del Norte region. We are all located in El Paso, Texas today. In general, the Paso del from region refers to South Central New Mexico, West Texas, and the northern border of Mexico just across from El Paso and southern New Mexico. As you can see, El Paso is way in the west side of Texas, right on the border with New Mexico and Juarez, Mexico. We're actually closer to San Diego than we are to Houston. So Texas is a very large state. Next slide, please. We would like everyone to answer a quick poll for us today. Have you ever heard of value chain coordination? Please select your answer and submit. Have you ever heard of value chain coordination? Select your answer and submit. Thank you. Okay, so the majority of attendees today have not heard of value chain coordination, which is great. That means hopefully we will be presenting some information that is new to many people. We'll be talking about the work that we have going on here in this region. Next slide, please. Value chain coordination is a market-based approach to developing local and regional food systems that better serve communities. Value chain coordination includes the development of collaborative ties among businesses along the food supply chain, with the expectation that the economic position of these supply chain members improves. On the left, we have a picture that includes the internal value chain support that our group of partners are providing here in this region. This includes producers such as farmers and ranchers, aggregators and processors, and aggregators can include food hubs, and we have Adriana with us today who is part of a very important food hub in our region. Distributors, we have wholesale and retail end of the supply chain here, and consumers, and then goes on around that circle. So you get waste disposal and input suppliers cycling back into the producers. On the external value chain support, this can include activities such as policy advocates, researchers, marketing experts, lenders, local government, and outreach partners. And so today we're going to be talking about work that's been going on in this region for the past 5 to 6 years in this area of food systems and value chain coordination, with the ultimate end goal of improving access to healthy and affordable food. Next slide, please. So in El Paso County and Juarez, about 5 to 6 years ago, our center worked to do a needs assessment. This needs assessment included a mapping project. I'll show you some of those maps in a moment, that overlaid supermarket sales, income level, and death due to diet-related diseases. We also did a survey of residents in the region, especially in the higher need areas of the region. And we did interviews with over 30 stakeholders working in some area of the food system. In Juarez, we didn't have access to the same kinds of data that would allow us to do the mapping project. We chose instead to do focus groups. And then what we did was we convened stakeholders at a food summit and discussed the regional data that we had collected. We presented national best practices from around the country and identified strategies for the region based on input from those stakeholders. I'm going to go over a little bit more about what that process resulted in. It was published in a report called the Food for Every Child report, which is available online. And if you're interested in seeing that report, you can reach out to me through the chat box or at the end of the session, and I can make sure you get access to that. Next slide, please. This first map that we did looked at grocery store sales, and briefly, if you can't quite make out the legend, what this map does is it shows grocery store sales. The darker black circles are the higher weekly volume of grocery store sales. The lighter gray areas are where there are lower grocery store sales. Next slide, please. Then we took the grocery store sales relative to the total population. So with the darker brown areas, you see where there's many more grocery store sales than there are people living relative to the pale yellow areas. Next slide, please. We overlaid those supermarket sales with income level. And so the red sections of this map show the lowest income level with the lowest grocery store sales, whereas the green areas show the highest income with the highest sales. So those people living in the green areas have kind of the best of both worlds. They tend to have higher income levels, and they also tend to have easier access to grocery stores, with just the opposite being true in the red areas. Next slide, please. Next, we looked at a map that overlaid income and diet-related death. So diseases such as obesity, heart disease, and other diseases that are linked to diet. And again, using a similar color scheme, the red areas are kind of the worst case scenario. So low income levels and high death due to diet-related diseases, compared to the green areas, which are high income levels and low death due to diet-related diseases. And then the blue and the yellow are the two in between categories. Next slide, please. Then what we did was we combined all of those categories together. So we looked at low grocery store sales, low income levels, and high death due to diet-related disease. And those sections are indicated in red on this map. So this map really shows where we have the highest need. We presented this at our food summit to highlight to our stakeholders that these are target areas where we want to make sure we focus activities that are spatially limited, especially so that we're hitting people that live in these target areas. Some of our activities have been more system-wide, so they impact the whole county and the food system more broadly. But when we're targeting areas that are neighborhood specific, for example, we look to prioritize these red areas. Next slide, please. Our survey finding indicated that the large majority of people use supermarkets, grocery stores, or super centers as their primary source of food. Fruit and vegetable intake was far below recommended levels, and about 1 in 3 people experienced food insecurity in those we surveyed. We did not do a sampling survey. We did a survey based on target areas of the county that showed highest need. So this is why the food insecurity rate was higher in our survey than based on USDA data collected. For those nationally collected data, our county fluctuates between about 11 and 13%, at least prior to the COVID pandemic. Next survey, please. I'm sorry, next slide, please. In focus groups that we did in Juarez, we concluded that poverty levels were much higher in Juarez, and that played an even larger factor in access to healthy and affordable food. Low wages and high cost of living were tied in with that. And in Juarez, as in Mexico in general, the government safety nets are not available or they're unreliable. So they don't have as consistent a system for things like school lunch programs, programs like SNAP and WIC. It can vary quite a bit from location to location and can vary quite a bit depending on the political influence at a given time with those people that are in a. And oftentimes people were telling us that they had to make choices between purchasing medicine or food, or purchasing school supplies so their children could attend school, or purchasing food. So those were the main challenges that we heard from these focus groups. Next slide, please. At the Food Summit, when we presented these data, we asked the stakeholders attending to help us prioritize strategies that they thought would be most important in our region. And the 3 primary approaches that they prioritized to improve access to healthy and affordable food were strategies to increase SNAP participation, partnerships with food retailers to provide health screenings, health education, and SNAP outreach in grocery stores, and a healthy food financing initiative to increase healthy food retail opportunities. Next slide, please. And next, I'm going to turn it over to Gabriella, who is going to expand on the healthy food financing initiative component of this.
All right, as we saw with the Food Summit, there were 3 key priority areas that included SNAP enrollment, increasing SNAP enrollment, healthy food financing, and increasing the in-store offerings such as nutrition education and other possibilities. So first off, what is a healthy food financing initiative? A healthy food financing initiative is a public-private partnership that provides grants and loans to finance the construction and development of grocery stores and other healthy food retailers in underserved areas. Now, other HFFI programs are funded by the state, such as Pennsylvania, where the first HFFI-like program was started. In New Orleans, that program was funded with FEMA funds post-Katrina. And then in other places, especially in Texas, they've been funded by different cities. So for example, Fort Worth has put money into an HFFI program there. So many of the HFFI programs that we see in different parts of the country really focus on fresh fruits and vegetables. And some of them additionally prioritize locally grown fruits and vegetables, and even the status of the applicant. So that might be that there's a preference for entrepreneurs of color or women entrepreneurs. Next slide, please. In El Paso County, the program is very specific to this county, of course, and it includes grants as well as low interest loans. It's open to both businesses and nonprofits as eligible applicants, and it's focused on healthy and affordable food rather than fresh fruits and vegetables, and is specific to food retail and retail infrastructure. The projects must benefit low to moderate income residents, and those areas of high need are really mapped toward the maps that Leah was showing earlier as those red areas that we could kind of speak directly to identifying those areas that were high diet-related deaths, low income, and low grocery store sales. The purpose for El Paso County's HFFI program is to expand a new retail outlet, expand an existing retail outlet, improve an existing food enterprise, or develop a real estate project. The real estate project does need to be one that will then house a food retail outlet. And so all of this HFFI program is very much tailored to food retail and food retail infrastructure. El Paso County later added a couple of additional guidelines. So grants in El Paso County are limited to $150,000, and they also require a significant amount of owner's equity or financing to constitute the total project cost. The eligible activities include pre-development, site assembly and improvement, construction and rehabilitation, equipment, staffing, staff training, security, inventory and working capital, as well as marketing and nutrition education. So it really is a comprehensive program that allows small business owners or larger business owners to consider what would improve, develop, or change their current retail outlet. Next slide, please. El Paso County's HFFI, like all the other HFFIs, have 3 essential partners. And so first, it requires a public investment. In our case, that was El Paso County, and El Paso County is very proud to have been the first county in the nation to have offered this sort of program and put funding into it. El Paso County committed $500,000 in grants. We are partnering with a community development financing institution, People Fund, that has pledged an additional $500,000 in loans. The third essential partner is the food access partner, and that is where the UTHealth Center for Community Health Impact comes in. And that is really Leah and I who have been serving as that role for El Paso County HFFI. And that includes a broad range of technical assistance that I'll get into in the next slide, please. So the role of the food access partner includes a very broad range of items. We have worked very closely with the El Paso County Economic Development Office in developing the program, but starting with everything from the application process design, from management, from reaching out to potential applicants and working with them to develop suitable projects for HFFI funding, to support those projects and the applicant organizations as they go through this process. And then we will be working with them, and we have already started on the monitoring, evaluation, and impact assessment of those projects that are funded through HFFI. The design, development, and management of those projects as well. In-store services coordination that I will get into more detail about in just a moment, but you'll remember that that was one of those 3 priority areas that came out of the Food Summit. And then reporting to El Paso County commissioners, both on the status of the projects as well as on future funding recommendations. So truly working closely with El Paso County and the Economic Development Office in particular, we've been going soup to nuts on this program. So once the policy was passed, that entails looking at what does an application look like, since we are looking at healthy and affordable food rather than fresh produce or locally sourced produce. What sorts of components do those applications require? It really developed into an iterative process where we worked closely with applicants to make sure that they were in a position to present a strong application for that funding. And some of that would mean tailoring it very specifically to this program. For example, we had 2 applicants that have a farming component to their operations. And now the farming component would not be something that is fundable under this particular program, but their retail side and how they're selling the food that they may be producing is very much appropriate for HFFI. We also considered, all of those components that were earlier mentioned to make sure that they matched up well with the project expectations, and so that we could present strong cases to El Paso County commissioners for funding each of the projects going forward under the first HFFI year. In addition to all of that, there have been agreements. So in addition to El Paso County Economic Development, we're also working with the County Attorney's Office. So of course, the grant agreements between the county and any of the grantees, the grant agreement between the county and People Fund, the Community Development Financing Institution, to help buy down that interest rate and offer low interest loans to HFFI applicants, and then to agree and specify the details of the relationship as the food access partner in El Paso County's HFFI program. Next slide, please. To impact food access, we want to support an environment where healthy choices are accessible and affordable. So HFFI is really the foundation of this. And it's a multi-layered approach that includes individual efforts as well as higher level efforts such as the county's effort with HFFI. So starting at the bottom, looking at HFFI as the foundation for improved healthy food retail access. And then the next level is in-store marketing, which includes changes to the physical environments of retail that would support healthy food choices. And examples of this might be changes to the physical store. So for example, if a store is considering retrofitting its interior so that the produce sections are not hidden in the back of the store, but maybe are towards the front of the store where they have a higher marquee value. And then also doing things like healthy checkouts. So an example of that would be having, a banana tree at the checkout location as you were getting into line versus, candy bars, nuts, and kind of other products. So those sorts of marketing changes could increase the physical environment so that people can more easily see those choices and hopefully will start to make some of those choices. Next are the pricing incentives, which would benefit retailers and consumers by increasing buying power, as well as by making healthy choices more affordable for them. In-store education includes nutrition education and demonstrations that expose consumers to healthier ways to prepare meals and get an introduction to nutrition while doing their grocery shopping. Dietary counseling is the most individualized element of the pyramid, and that might take place through health providers and other individualized programs. Next slide, please. The in-store programming was one of those 3 key recommendations that resulted from the Food Summit. And this coalition work began through the center, working with a number of community partners, drawing on some of their efforts that may have already been established, introducing new ones, and also increasing the ones that were already in existence. So for nutrition education, we've worked with them to implement a Heart Smarts curriculum, and that's delivered by 2 partners, Texas A&M AgriLife Extension and the Texas A&M Colonias Project. Health screenings is another element of this, and we have worked with partners also at UTHealth through their Healthy Fit program and at the University of Texas at El Paso that are doing in-store health screenings. SNAP enrollments, we've worked with Centro San Vicente as our partner on doing in-store SNAP enrollment and outreach and education. And for WIC enrollment, the City of El Paso WIC program has been a strong partner in also conducting that outreach and enrollment services. So the idea behind the in-store programming is to reach consumers as they're doing their grocery shopping. So if they were to go grocery shopping, they may receive information on SNAP and learn that they are eligible for benefits that they are not currently receiving. They may see a nutrition demonstration and learn about a recipe that teaches them a healthier way to prepare something that they ordinarily prepare. And maybe they get their blood pressure screened or some other health screening that will help them along the way. So doing all of this in the store is, again, trying to improve the educational experience, but also nudge consumers toward healthier choices that will also be affordable for them. Next slide, please. So our pilot program granted 3 applicants the initial HFFI grants, and these were decided on almost, gosh, I think weeks before our COVID epidemic took hold, and just a few weeks before the stay-at-home orders were introduced in this area. So the timing was pretty incredible on these, and I know Adriana will talk a little bit about what that meant for the food hub. But the first grant that El Paso County approved was to Desert Spoon Food Hub, and that was for $150,000. And that it allowed them to do a lot with the food hub, including expanding residential delivery of a locally sourced produce box program, open a mini market in one of those high need areas, which was one of those red areas in the map that Leah introduced earlier, and importantly, establish a food hub serving local producers. The next one is Growing with Sarah Farm, and that was for $63,000. And that was to renovate an existing structure as a farm stand to offer local produce and products. This is located on a heritage farm that is on the far east side of El Paso in a very rural area. And they are in the process of both introducing and I guess reintroducing farming on their property, as well as renovating different structures to create a community hub with different options for things like, maybe it's restaurant, retail, that sort of thing. But the most important component of that is this farm stand. And hopefully that will allow the producers that are in that area to have a retail outlet that reaches the community in that area. The last was kind of our wild card applicant, and this is Extreme Core Fitness, and they were awarded $18,000 to purchase equipment and hire staff to expand food prep offerings and delivery. So this application came in, and it was a little bit different than others that we had seen. And it started as a gym that then added and expanded an area to offer food preparation services. So they have been doing prepared meals for consumers in their area, and they have served lower income and middle income folks in their area. That includes teachers, truck drivers. It is in an area of town that is rapidly developing, and it is highly populated by fast food, but not by other healthy food offerings. So they were finding that their food prep was able to reach a consumer that was unexpected. And so because El Paso County's Hffi program is flexible for healthy and affordable food, we were able to look at the definition of retail, consider what the line was, because restaurants and cafes do not qualify for HFFI, to understand and determine whether this was something that fit within the spirit and the plans for the policy. El Paso County Commissioners agreed this is much more retail focused than restaurant and serving focused. They do not have, a restaurant component to their business, but it was just one of those things that allows for some flexibility when dealing with applications that could potentially have a significant impact, but maybe don't look like the rest. And so this, like I said, this was one that didn't look quite like the others, but had a significant possibility of making a real impact in its area. And next slide, please. So as we started with HFFI, it has really formed the foundation for what we hope to grow into a healthy food system partnership and create a larger vision for the region. El Paso County has been a very strong and significant partner and are deeply committed to this work. And they have made this a priority as they're looking at how healthy food and healthy food systems might impact the local economy and really serve constituents. So as part of that overall vision for the region, we first want to make sure that we're investing in small businesses. And that goes hand in hand with working with the El Paso County Economic Development Office. Next is to strengthen food systems and infrastructures. As we have done this work, we've learned about gaps, and as you can picture on the map where El Paso lies in between other cities, you can also see that we are sometimes difficult to reach and may not have the same potential infrastructure in our area. Next is to expand SNAP enrollment and close the SNAP gap. El Paso, as of a number of years ago, had almost $91 million that was left on the table by our residents who are SNAP eligible but are not currently accessing those benefits. And that gives them potential buying power. It helps our retailers as well, and it hopefully changes the availability of healthy and affordable food to those who need it. Next is to reduce food insecurity, and last is to improve the overall health of the region. We know that that is the long-term goal, and that multi-layered approach that we described earlier in the food access impact pyramid is truly setting the stage for impacting overall health. as the long-term goal of this food system partnership. And I think next we have a poll. If you would take a moment to please answer, do you know what a food hub does?
No, where's my?
Okay, so we have
Okay.
results. And that is
Great.
30% say yes and 64% say no.
Well, the next part of our presentation will help people understand what a food hub is. And Adriana is having a little technical difficulty. She's working on getting logged back in right now, but I will cover some of her slides until she's able to join us again. So a food hub is a centrally located facility with a business management structure facilitating the aggregation, storage, processing, distribution, and/or marketing of locally, regionally produced food products. And you may recall from one of the early slides, we talked about internal value chain coordination. This is really the role that, that Desert Spoon Food Hub is playing in our region. Adriana, are you online now?
I am. Can you hear me?
We can. We'll let you take it from here. I just introduced the Food Hub slide.
Thanks, Leah. I'm going to go ahead and keep my. Hopefully we don't run into this again. But if we do, I have full, I know you're fully capable of explaining food hubs as well. Okay, so that poll was interesting. So this first slide, Leah already kind of mentioned what a food hub is. Food hubs can take many different forms. So in this definition, it says a centrally located facility, and while a lot of food hubs actually have that infrastructure as a physical place, food hubs also can rely on community assets to form the food hub, and that might look like if a food hub is working with a local food bank or a local food distributor to use their fleet to move local products. Some food hubs even focus more of their efforts on the actual human capital of creating social relationships and the sale and marketing of those food products, but then rely on the producers to actually have the cold storage and the fleets to the transportation and movement of it. Of course, on that last model, that depends highly on the level of skill of production in the region and of course the revenues that they have. The form we take is primarily with the local facility. Production in our region is not quite as robust in other regions, and so we have to offer a lot of that support to our producers. Next slide, please. So the underlying shared goal of food hubs is to increase food availability and security in the region, and then to also offer a greater representation of smallholder farms in the food system, allowing for that food system to be more localized and also have more players part of it, which gives it this level of protection, right? We work to provide opportunities and experiences that are centered around food, harnessing the power that it has to create a more fair and just equitable community. We place emphasis on the value and dignity of labor in our food supply chain, and we put energy into creating a food system that works for everyone. So ultimately, food hubs look to place the power of food and food production back into the hands of the communities it serves. To achieve this, we share in the belief that, like everything else, farmers are stronger when they work together, and that the resilience of our community is reliant on them sticking around. So While the Food Hub's primary focus is on the distribution of local products and strengthening that producer to consumer relationship to add value to those products, this diagram shows the many investments that are needed to create that localized, resilient food system, and the value chain coordination that is needed amongst many organizations to provide these services. So the three main challenges for local farmers that we're seeing is access to land, capital, and markets. And so to address these challenges, much like Gabriella was saying earlier, are these kind of policy reforms and changes like Hffi that gives opportunities and low interest loans and grants and possibly even land trust so we can increase that access to land. And then another part is the ever-changing challenges, of course, of our environment and climate change. We need innovation and we need research around production. And then with the aging population of farmers in our region, and then what we're seeing across the nation, the loss of cultural knowledge poses a problem for the effective support, training, and education of farmers. So you're seeing that there's a lot of organization, there's a lot of services that are needed. And while the Food Hub is primarily focused on the movement of food, all these organizations that supply these services have to work together. And that's primarily what your value chain coordination is doing. Next slide. Okay, so on this slide, we're showing the food flow network. This was a study that was completed in July 2019 by the Department of Civil and Environmental Engineering at the University of Illinois. So you can, I think we all can kind of see that, you know, the industrial food system or the food system that we currently have is very robust and is highly efficient on moving food at low cost. But with this, we can kind of also see that there are pockets within our nation that are not equally represented in our food system. So like, for instance, our region, the Paso del Norte region, which is far west Texas, southwest New Mexico area, we see that there isn't as much connection activity happening on these maps. So the first map that you see is actually the freight analysis framework that they did. And then B, the diagram B, is actually the movement of food between counties. So when we use the term food deserts, we're often referring to communities and neighborhoods that lack access to healthy food options. And I think that these models give us a really good bird's eye view of the complexities and impacts that our food supply chain has on food deserts. And in case with our region, that our food deserts, the amount of food deserts that we have is quite high. Next slide, please. So when we're talking about food and food systems, it reflects some of our most pressing challenges when we are talking about food security, climate change, and poverty. And the current pandemic only amplified these challenges and exposed inefficiencies within our systems. On the consumer end, we were seeing endless lines of food banks and pantries. We saw food shortages. And on the production side, we saw farmers having to plow, or hear stories about farmers having to plow crops back into their field and ranchers having to kill livestock. So on one end, we had a shortage, and on the other side, we had surplus. And this was simply because our industrial food system was rigid and was not able to adapt and shift to these market needs. Next slide. So for Desert Spoon, we had 5 years underneath us developing infrastructure needed for a more localized food system that was able to adapt and add a layer of protection for our region from these disruptions that we were seeing. So you can kind of see you can see on that diagram that we have arrows that are pointing out on one end, and that's the services that we're providing out into the community by creating outlets for our producers. We have a retail direct-to-consumer outlet. We have wholesale outlets, And then we also provide, policy assistance and food system education on bringing awareness. On the other end, you have your local farmers, and those have arrows going in both directions, where we're taking in goods and purchasing products from them, but we're also providing logistical support to them, which might look like production planning, marketing for their products, and even possibly financing some of their projects as well. On the side, it's just giving a brief bullet points exactly kind of what we're focused in on. So it shows the market and the aggregation of products and the sale of those products. A big thing of what we're doing and it ties into the value chain coordination, is facilitating these relationships between farmers and consumers and buyers. And then the community education aspect. A lot of times we get confused, or we kind of get in a category as a food distributor. And while we are in the business of distributing food, one of the main things about food hubs is that we're not so defined by the actual business structure, but more so by the function and producer outcomes and impacts of our operations. Next slide, please. So this slide just gives a little summary of kind of what we're seeing and where our operations are at. So prior to COVID, we had a 900 square foot warehouse space that was located in Las Cruces, New Mexico, which is very close to El Paso. We were doing about 30 to 40 produce boxes, which is our direct to consumer outlet. And we had 20 wholesale accounts, which included restaurants and school districts and our local hospital, county hospital. We had a service area of about 6 zip codes, and we had an annual revenue of about 100,000. With the Hffi grant, that was actually, those funds were injected on March 23rd, which is actually about a week after COVID. We started seeing the school districts close their schools and restaurants closing. Have about a 2,900 square foot warehouse space, and that's a new warehouse that was acquired in central El Paso, and we still have our Las Cruces warehouse. We are averaging about 236 produce boxes a week. We have 5 wholesale accounts, a 16 zip code area, and a projected annual revenue of about 315,000. I think what's important here is to see the shift that had to happen within a short time frame as far as the direct to consumer sales and the wholesale accounts. So what we saw very quickly was a large loss in wholesale accounts through school districts and even the hospital, and of course the restaurants that were closing down that were customers of ours and customers of the producers that we work with. But what we were seeing, that there was a huge demand on the consumer side to have access to these foods. What happened on the consumer side was this awareness of local food systems and trying to get a little bit more connected to our local producers. I think what we're seeing, that people were going to the store and they saw shortages, or for some reason becoming a little bit more aware of what, the industrial food system and efficiencies in it. So next slide. So because our work is on both sides of the food system, we felt the stresses on the production side, but then also on the consumer side fairly quickly through hunger and food shortages. And so the stresses was largely seen throughout our community, was seen through food access. So with the increased demand and workload that we were seeing on our operations, we were able to work with a local nonprofit and become a partner organization under the El Paso Get Shift Done program, which offered paid shifts for laid off hourly workers in the restaurant and hospitality industry. And then we launched our COVID-19 pandemic response program, which was a hunger relief program called the Food Project. And this program was deeply rooted on both sides of the food system as well, helping small farmers sustain their livelihood, but then also making access to fresh fruits and vegetables attainable for all. So the food project allowed us to procure fruits and vegetables at retail prices from local producers. And the importance of that is that a lot of the producers that we work with are small farm holder producers, and they rely on farmers market sales. And a lot of the farmers markets took a pretty large hit. And so those retail prices that they normally would see was not there. So that enabled us to be able to offer higher prices for their products, but then turn around and provide those food boxes to the most vulnerable using our contactless delivery model. So the implementation of this program, we were able to utilize the existing infrastructure and systems that the Food Hub already had, such as our warehouse packing, storage, and delivery routing software to make it more efficient. And that concludes.
Thank you. All right. Thanks, Gabriella and Adriana. We are now going to move into the Q&A part of the webinar. So please be sure to type your questions into the chat box. And while we wait for questions to start to roll in, I'm just going to just note that the work that we highlighted that's been in progress over the last 5 to 6 years really laid the groundwork toward strengthening our regional food system. And COVID, like so many communities and regions, of course, has had a terrible impact on the people living in this region. But one of the opportunities it has afforded us is to really open the eyes of decision makers and people in leadership positions, elected officials, and so forth, really open their eyes to the importance of addressing the strength of the food system. So it's really providing those of us that are partnering in this area to open dialogue, open communication with people in these positions. You know, it's really become clear that SNAP enrollment is an issue, that value chain coordination, strengthening that will really help us respond in a better way to emergency situations like this. And I think it's also really shown how critical the role of a food hub can be in a regional food system. The fact that you saw in those last few slides that Adriana shared, how nimble Desert Spoon Food Hub has been in response to this pandemic. And, you know, to be able to flexibly within a matter of weeks triple their output of those direct-to-consumer fruit and vegetable boxes, for example, has been really, really powerful. And I think it's really given us this great opportunity to show other leaders in the region how important our regional food hub is, and this coordinated work for the value chain. So we've got our first comment here. I'm so happy to learn about your VCC work, value chain coordination work. I'm also embarrassed that I haven't known about you until now. I'd like to be in touch and share your work across Texas. We have a couple of projects that we could perhaps work together on. One is Sustainable Directory of Food Systems, or I'm sorry, one is a statewide directory of food system resources so we can better leverage our amazing assets. So that's, I'm not quite sure who posted that, but we will gladly look to get in touch after the webinar. One of the questions that got posted, what's one of the biggest challenges faced with, I think what they're meaning to say is, what is one of the biggest challenges faced with food hubs? Adriana, would you like to tackle that question? What's one of the biggest challenges you face?
Yes, so I'm gonna assume that it's talking mainly on like the actual operations of the food hub, and with all food hubs, it all comes down on sustainability of the food hub. So when you're working with local producers and local food, the system is not as efficient as our industrial food system, and so price points and margins are always going to be an issue, because ultimately we are competing with the current system that we have. So our financial viability is always a concern, and that's why you see, I think there's over 300 food hubs in the nation, and primarily most from our nonprofits that rely on outside sources to continue our operations. But not to say that we all have to have, all food hubs have a revenue stream coming in. And because if you remember, the food hub itself has that business structure and operates as a business to make sure that those revenue streams are maintained. Now, as far as a food hub and what we saw for the COVID pandemic, the challenges for the food hub was really that shift. Luckily for us, we had about 2 months between, we were currently, when COVID started, we were in a low production season, kind of a switch between seasons, planting seasons. So we had 2 months to make that shift. And we're still probably about a couple weeks out before we hit our high production season. And, you know, our ability to be able to make that shift, and we're able to get those products out into the market.
A related question to that, Adriana, did you have to scale up your transportation route management? If so, how did you do that, and what resources did you use?
Yes, we did. So initially with our operations, we had, and this is talking mainly about our consumer outlets, because that's where the demand was, and that's where we had to push our focus on. So we had 5 pickup locations. We worked with local businesses where individuals could go pick up their boxes pre-COVID. And then we also offered home deliveries. Once COVID happened, we quickly realized that those businesses might not be open at some point, or it just added an additional risk and exposure throughout our community. So we reduced it down to 1 pickup location and then shifted everybody else to home delivery. So if you can imagine, that takes quite a bit of work. So we have a volunteer base that assists us with home deliveries, but then also we have our routing software where we can log in all those home deliveries and efficiently create a route system for them every week. And so really that just takes an investment in a software that works for your organization at the level at which you're in. There's some really robust ones, which is highly expensive, but we're talking about nonprofits here. So we're not gonna be looking at those. So that we're able to use and import, we, you know, it's a monthly fee that we use based on the numbers that we have.
Great. We have a question here about food banks. Is there currently an entity that is responsible for coordinating food banks across the state to ensure they all have product available? Yes, there is. This is typically coordinated at the national level. And just to make sure everyone's on the same page, food banks typically serve a region, and then the food pantries within that region get the food from the food banks. In our region, our food bank is called El Pasoans Fighting Hunger, and they are part of this national system that coordinates getting bulk products from government sources and from companies. If there's product that, for whatever reason, is available for donation, it gets into this food bank system, and distributed throughout the country. And then regionally, there can be efforts to get locally produced food to food banks, to the food bank, or distributed out to the food pantries. Typically, the pantries are the organizations that handle the direct handoff to the people. Not always. In some cases, the food bank actually offers pickup opportunities at their warehouse as well. So that's how the food bank and food pantry system works nationally, and it is coordinated. We have a great CEO of our food bank here in this region who's done a fabulous job in the last couple of years that she's been in that role to tap into national sources for things like fresh fruits and vegetables, which weren't as prevalent earlier. We also have a great group that produces over 100,000 pounds of fruits and vegetables just from a donation standpoint. It's called Jardín de Milagros, and it's run just for the purpose of growing vegetables to donate directly to a local food pantry, and then any excess gets distributed through the food bank as well. So we've got a great network of people here in this region working to make sure that the food bank and food pantry system has access to product. The next question, has your program collaborated with or been modeled in any way after the Paso del Norte Health Foundation Healthy Eating Active Living HEAL initiative? So yes, so the center that started this work that I described at the beginning of the webinar with the initial regional assessment, that project was all funded through the center that I directed, and that was funded through the Paso del Norte Health Foundation HEAL initiative. We were originally founded to be the backbone organization of the HEAL initiative for the Paso del Norte Health Foundation. So we are very closely aligned with that initiative, and this needs assessment related to food access, availability, and affordability was part of the original strategic plan that I worked closely with the Health Foundation to develop for their HEAL initiative. So yes, we are closely partnered with the Health Foundation. How long did it take for you to do the original analysis, interviews, data, and research? I think they're also referring, that question is also referring to the needs assessment. We partnered with the Food Trust on that project, and I would say once we got contracts in place and we're up and running, it took about a year. So about a year to collect the data and then hold the food summit and get the Food for Every Child report written and published. And then from there, we started acting on those priority areas that we identified through the food summit. So really coordinating a task force to develop a healthy food financing initiative in the region. That took a couple of years to get that whole process developed, the policy passed, and then as Gabriella described, the process to get the actual program in place. So that's been, the HFFI effort has been a couple years in the works since the food summit. At the same time, we also established the InStore Coalition, this group of organizations from around the community that work together to deliver these services within grocery stores. And now those in-store delivery of program and outreach is that aligns with the HFFI grantees. So all of that work has been kind of running in parallel, partnering, pulling together multiple organizations and coordinating that effort. And everything we talked about today has been happening for about 5 to 6 years. All right. If you have any more questions, we have about 2 more minutes. You are welcome to submit them in the chat box. I'm just checking one more time to see if there are any questions I've missed. Gabriella, do you have anything to add to the Q&A discussion that we've had so far?
I don't, it's been such a great partnership between the different entities and working closely with the county to really move things forward, as well as partners such as Desert Spoon Food Hub. So we're hoping that the overall vision is ready to take next steps, and hopefully that'll continue. Great opportunities have come from the COVID-19 crisis, and hopefully our ability to be creative continues to be challenged. So we're keeping all of that in mind as we look forward to next steps.
Well, it looks like we're coming to the end of our hour, so I would like to thank everyone for attending today's webinar. We appreciate you being here. Remember, this webinar will be archived on our website at msdcenter.org. Thanks again for joining us today. And this is part of a seminar series, and we hope to see all of you attending the next seminar in the series. Have a great day.